Okay, well, welcome to the call, everyone. Today's call, we're going to be talking about lower back pain, and we're going to be talking about core strength. We've got on the phone, I guess I would consider anyway, one of the sort of leading authorities in low back pain and also in core strength. It's Dr. Stuart McGill. He's the Professor of Spine Biomechanics at Waterloo University in Canada. His advice and work are sought after by governments, corporations, legal experts, athletes and sports teams from all around the world. He's the leading authority in low back pain, core strength, and you can find all of his work, but a lot of his work, books and DVDs at www.backfitpro.com. I can highly recommend these because I've got them. I've got the low back disorder book, I've got the 2 DVDs on there, so I can sort of personally say that I highly recommend the books and DVDs on that website. So without further ado, I'd like to introduce Dr. Stuart McGill and just get him to sort of talk a little bit about your background, how you come to become such maybe an authority on core strength and lower back pain. So yeah, Stu, please do take it away.
All right. Well, good morning, Chris, first of all.
Morning.
Well, I guess I've been a professor 26 years now, coming to the end of it all, I guess. But in any case, I trained as a scientist, not as a clinician.
Right.
And, maybe 25 years ago, I would attend different orthopedic and neurology meetings, and the docs would say, "Would you please see a patient for us?" And I would say, "No, I can't because I'm not a clinician." But they would say, "Well, we'll come to the consult with you and show us what your eyes see." Right. I did, and soon realized that with my training and my background, I would see things that they didn't in terms of causation pathways, some ill advice that they were prescribing that was going against what our science was showing as being appropriate for both taking pain away and creating other issues. So that's how it all started. And then, I was asked to see some high-profile athletes, and that turned into consulting for Olympic programs and professional teams. So now I think I've seen folks from just about every sport on this planet.
Yeah. Blimey. Well, yeah, it seems like quite a journey, quite a natural progression, though, I guess, and sort of trying to find out the cause of this phenomenon, I guess you could call low back pain, because it is quite an intertwined, or I've certainly found it to be quite an intertwined subject. But yeah, excellent, cool. Well, again, thank you, and I guess we're ready to go with sort of the first sort of question that leads us into low back pain, and the reason I want to ask this question is a lot of what I've been learning, reading, and when I go and see various people, when I'm learning as a student, I guess you could say, they talk about this non-specific lower back pain, and I know sort of through reading and listening to your work, you've looked and sort of found maybe a very general and common cause of low back pain. And I also want to know what your opinion is of the non-specific low back pain. So if you want to just sort of try and tackle that question.
Okay. Well, if one of your listeners has been told they have non-specific low back pain, or they've read a study about non-specific back pain, my view is there's no such thing. It just means they have not had an assessment. Right. If that patient or individual has undergone a thorough assessment that has involved provocative testing, which involves finding motions, postures, and loads that cause the pain and make it worse, you've identified a good part of the cause. Right. And now that gives you a very solid clue as to how to proceed with the treatment. So the causes of back pain, I wish I had a simple answer for that, but I'm not going to default and say we don't know. In fact, I would take the opposite view and say we know precisely what causes back pain.